What is a pericardial effusion? So let's start by breaking down the term into its roots. So the root card tells us we're talking about some aspect of the heart. We can think of words like cardiac or cardiovascular. The root peri, which we know from words like perimeter, means around. So we're talking about something that surrounds the heart, and that something is called the pericardium. The pericardium is a sac of tough connective tissue that surrounds the heart. And between the pericardium and the outer wall of the heart is a space called the pericardial cavity. And in this space, there's a tiny amount of fluid that keeps the friction between the heart and the pericardium to a minimum. Okay, so we know what the pericardium is, but what does it do? So to answer that, let's take a look at what the heart does on a day-to-day basis. So here we have the right atrium, and here we have the left atrium. And blood returns from the body to the heart at the right atrium, and blood returns from the lungs to the heart at the left atrium. Now below the atria are the ventricles. The right ventricle is responsible for pumping blood out to the lungs, and the left ventricle is responsible for pumping blood out into the main body circulation. Now as the ventricles fill up with blood, they stretch out. You want the ventricles to be able to stretch out as much as possible before they contract, because you want as much blood to enter circulation as you can. However, you don't want the ventricles to stretch out so far that they lose their strength and they tear. So the pericardium, being made of this tough connective tissue, keeps the ventricles from stretching out too far on a day-to-day basis. So if you're trying to imagine what the pericardium does, think of it this way. Imagine the heart as a really thin, cheap dollar store water balloon. It can expand really far without holding much water, but in the end, it always breaks at the nozzle, right? And if you're in a water balloon fight, you can't have that. So what you decide to do is take a thick water balloon and put the thin water balloon inside the thick water balloon so that when you fill up the thin water balloon, it doesn't burst. So now, when you go to fill up the water balloon, the thin water balloon is not going to explode because the thicker water balloon is going to be there to support it. This support function is exactly what the pericardium does for the heart. Now imagine that a small hole develops in the thin balloon so that water flows into the space between the two balloons. The word effusion is really just the $10 word that describes movement of a fluid through a small hole. So if we put the definition of effusion together with what we know about the pericardium, we can figure out that a pericardial effusion is when a small hole in the lining of the heart develops that allows fluid from the heart, from the main body circulation, into the pericardial cavity. The main threat we see in a pericardial effusion is back pressure put onto the heart. So when the space between the heart and the pericardium fills up with fluid, that fluid pushes back against the walls of the heart so that it can't expand as far as it normally would. So when you have less blood in the ventricles, you have less oxygen getting into the blood, and you also have less blood entering into the main body circulation. So what causes pericardial effusions? So that narrow opening that's center stage in all of this is caused by anything that creates weakness in the walls of the heart. So, for example, during a heart attack, some of the muscle cells in the heart are going to be damaged. And if they're damaged so badly that they can't hold up under the high pressure environment in the heart, they're going to allow blood into the pericardial cavity, causing a pericardial effusion. Cancer can also weaken the muscle cells in the heart enough to allow blood to flow into the pericardial cavity. The same goes with blunt force trauma. If you get hit in the chest too hard, it can create a weakening in the heart's walls that'll allow blood to flow into the pericardial cavity. So all of these other causes aside, the most common cause of pericardial effusion is something called pericarditis. So pericarditis is really just an infection of the pericardium. So let's talk about infections for a second. So when the body recognizes an infection, it sends specialized immune cells to the site of the infection to kill off the bacteria or the fungi or whatever it is. And in order to get these immune cells to the site of the infection, the body sends more blood than usual to that infection site. So the area of the infection site swells with blood and immune cells. And you've experienced this if you've ever had a pimple. The area around the pimple swells and becomes red because the body is responding to an infection in the skin. So in pericarditis, the infection is in the pericardium, so blood and immune cells flood the area. And like I said, this can be caused by bacteria, by fungi, or by a virus. And to see pericardial effusions in HIV patients is not uncommon. So what is it going to look like when you come across someone that's suffering from a pericardial effusion? Well, it's going to look similar to what a heart attack looks like, right? They're going to complain of chest pain. They're going to look exhausted. They might be very anxious. But there are a couple of signs that you can look for that'll allow you to tell whether the patient is suffering from a pericardial effusion or from a heart attack. So first, ask them what the pain is like. So a pain associated with a heart attack is often described as crushing or heavy, like there's an anvil lying on the person's chest. The pain associated with a pericardial effusion is often much sharper. It'll feel more like a needle than an anvil. Second, ask them if the pain gets worse when they exert themselves. So if walking up a flight of stairs makes the pain a lot worse, then it's more likely that the patient's suffering from a heart attack. Most often, the pain that comes along with a pericardial effusion doesn't get any worse with exercise. So third, ask them if the pain gets worse when they lie down. So the pain associated with heart attack often doesn't get any worse when a person lies down. The pain associated with a pericardial effusion often gets worse when a person lies down. Finally, ask them if the pain is worse when they breathe in deeply. Heart attack pain usually doesn't get worse over the course of a breath, while the pain associated with pericardial effusion could. If you have a stethoscope handy, and a willing participant of course, you can listen for abnormal heart sounds as well. So in a pericardial effusion case, there's enough friction created within the walls of the pericardium itself that you might actually hear 3 heart sounds instead of 2. So you'll hear a lub-dub-dub instead of a lub-dub. Of course, seeing the heart in all of its glory is really the best way to tell if a person is suffering from a pericardial effusion. If you have the ability to take a chest x-ray or an echocardiogram, which is basically an ultrasound for the heart is going to look much larger than it normally does.